like to apologize for cursing in the last video. I grew up a lot of my life in military environments, whether it was my 30-year veteran father, military boarding school, or myself being in the Army. I hope it speaks to my passion for understanding medicine, nursing, and in this case, pathology, by me going back and understanding something that I knew at the time was somewhat of a contradiction and something that I may have not fully understood. So anyway, we have chronic alcoholism. While you're drinking, this leads to a suppressed sympathetic nervous system, particularly a downregulation of GABA. GABA is an inhibitory neurotransmitter of the central nervous system, and glutamate is an excitatory neurotransmitter. And so while you're drinking alcohol chronically, and your body tries to maintain homeostasis by downregulating the inhibitory neurotransmitter GABA and upregulating the excitatory neurotransmitter glutamate. This is because you're introducing a chemical into your brain that is inhibitory and a depressant. So your body, to maintain homeostasis, decreases the level of GABA because it's like, okay, I really don't need this neurotransmitter as much as I do because I have alcohol in my body, and it increases glutamate to compensate for that downregulation of GABA. So what happens here, when you are abruptly withdrawing from ETOH, which is in the medical community how we abbreviate alcohol, this causes an severely depressed GABA and a hyperregulated state of glutamate. So how does this present in terms of symptoms and signs? In terms of symptoms, the less worrisome ones are sweats, anxiety, and I didn't write here, but GI symptoms such as vomiting, diarrhea, and then the ones that we worry about most often are delirium tremens, which is a potential state of hallucinations, whether it's auditory or visual, and seizures. Seizures can be very, very dangerous because they can cause brain damage, and this is something that you really want to avoid. In terms of signs, we have increased blood pressure, increased heart rate, and increased respirations. So how do we safely help patients withdraw from alcohol? Most often you see a titration, which means giving medicine that is based off of a patient's physical history. Okay, so we're looking at how much they're drinking, how often they're drinking, and what they're drinking. And so often you see benzodiazepines such as Valium. Valium has a longer half-life than some of the benzodiazepines that you see, such as the alprazolam. And you're actually starting to see more often barbiturates, and barbiturates have a very long half-life. This is good in terms of withdrawal. You don't want to go back into that hyperregulated state of glutamate and hyporegulated state of GABA. So the barbiturates like phenobarbital, you're seeing them more often. You're seeing more clinical evidence for their use, but the problem is these have a very narrow therapeutic index. Phenobarbital has a very narrow therapeutic index. So you may run into a situation where you overestimate the amount of phenobarbital that someone needs, and you can run into severely depressed respirations, severely depressed blood pressure, and severely depressed heart rate. So that is basically the entirety. I guess